Miss Wells is a pleasant 28-year-old female African-American. She presented to the clinic with complaints of shortness of breath and wheezing following her near asthma attack that she had 2 days ago. She reported that she was at her cousin's house and was exposed to cats that triggered her asthma symptoms. At the time of asthma onset, she noticed that her wheezes were a 6 out of 10 in severity, and her asthma symptoms, her shortness of breath, were an 8 to 10 out of severity and lasted for about 5 minutes. At the time she used her albuterol inhaler, her symptoms decreased, although they did not completely resolve. Since that incident, she knows she's had about 10 episodes of wheezing and has had about 10 shortness of breath approximately every 4 hours. She notes that her current symptoms seems to be worsened by lying flat and movement and accompanied by a non-productive cough. She's awakening at nighttime up to twice a night with shortness of breath. She complains her current symptoms are beginning to interfere with her daily activities, and she's concerned if albuterol is less effective. She was diagnosed with asthma at the age of 2.5 years old. She's been hospitalized 5 times for asthma. The last stage was 60 years old. She did smoke marijuana about 5-6 years ago at the age of 21. She does not exercise. She denies smoking, tobacco, alcohol use, or illicit drugs. And she's not aware of any irritants or environmental factors that are contributing at her job or at home to her asthma. She's never been intubated for her asthma, and she does not have a current allergist or pulmonologist. Her last episode of shortness of breath was this morning before coming to the clinic. Currently, she states her breathing is normal at this time. She's got no recent use of spirometer. She doesn't have use of peak flow. She doesn't record her asthma attacks, and she does not have a vaporizer or nebulizer at home. Examination was her chest expansion symmetrical with respirations, normal fremitus, symmetrical bilateral chest resonant to percussion. There's no dullness. Bilateral expiratory wheezes were noted in the posterior lower lobes, and bilateral muffled words with notable expiratory wheezes in posterior lower lobes. There's no crackles. At this time, she's not in any acute distress. Her office spirometry were her forced vital capacity were 3.9, and her forced expiratory volume was an 80.56. Her pulse ox is 97. She's alert, oriented, and sitting upright at the exam table. She's maintaining eye contact and throughout the examination and interview. My assessment for her is she's having an acute exacerbation of asthma, and my plan is to assess her readiness to implement ICSs into her current asthma plan, and that would be bufenicide, 160 micrograms 2 puffs in the morning, 2 puffs at night. She can use the albuterol for emergency uses only at this time until the long-term medications are working. I do recommend a short-term course of prednisone for 5 days until inflammation wears down, and I'm using the GINA protocols. To me, she's had too many asthma exacerbations, and I think this is the best protocol for her at this time. Thank you.